Undiagnosed Medical Centre, Part 5. Today is the 22nd of November. So let's catch up on what's been happening. On the 30th of October, Doreen has just gone to Lister Hospital by ambulance. This is early in the morning. Didn't hear from Doreen, although she's got the mobile with her. So I phoned Lister Hospital about 2 o'clock to find out how Doreen was doing. It took me 10 minutes to get through to talk to someone. A huge amount of information on visitors and what they can, what they can't do. And then it went on about mental health. None of this is any interest to me at all. Why on earth can't they get a dedicated phone line for visitors? That way I would not be wasting time and money. I didn't have any mental problems before the call, but probably did after when I hung up. I phoned again at 7:30 in the evening. And after the same delay, I was told she was waiting for transport to get her home. Never heard no more. Doreen arrived home 11:05 at night. From 9 in the morning to 11 at night, 14 hours. And the hospital was about 10 miles away. When she got home, she was worn out and in severe pain. New pain in her back as she'd spent 5 hours sitting on a bench waiting for transport. The doctors at Lister said they did not have the correct dressing for her skin grafts. Doreen waited 2 hours and the dressing suddenly appeared. She recognised them straight away as exactly the same ones she had at Broomfield Burn Specialist Hospital. It's very possible that her delay was why the hospital got in touch with Broomfield and Broomfield sent the correct dressings over. 1st of November, Doreen has phoned the doctors to request that the prescription from Lister be made up and sent to the chemist. She said that she was told by the receptionist about her arm and that the doctor would have to make an appointment for her to go to hospital. The nurse came out of the blue to look at Doreen's feet, but agreed to come back tomorrow as she didn't have the correct dressings either from Broomfield. But she'd come tomorrow. 11:30, a nurse from Broomfield phoned. Not too sure why. 2nd of November, Dr. Page came to see Doreen's arm. She said it was probably a trapped nerve, but she'd make an appointment for Doreen to go and see a neurologist. She also said she would get a prescription down at the chemist for some more Oromorph, enough to last till Monday. A bit later, the nurse phoned to say they would not be coming today as the dressings had still not arrived, but she would come tomorrow. 3rd of November, Doreen was up again all night, complaining the bandages on her feet are too tight. We agreed to wait for the nurse to come. The nurse had not arrived, so Doreen phoned the medical centre to find out why. She was told that the nurse would not be coming out today because they still didn't have the bloody dressings, but she'd come tomorrow. Never-ending story. How long does it take to get these special dressings from Broomfield? You can't imagine. We decided to cut away some of the bandages to loosen them as they was far too tight and were causing more pain than necessary. What a long job. I had to lay on the floor with a Stanley knife to slowly and very carefully cut through the outer bandages and then the inner cotton wool-tight padding. The dressings have not been changed since Lister Hospital on Friday the 29th of October. So tomorrow will be 6 days without the dressings being changed. And yet again, that's far too long. 4th of the 11th. The madness continues. Nothing seems to change for the better. The district nurse phoned at 10 and asked if the dressings had arrived. I asked from whom and where were they supposed to go to. She said she thought they had gone to the local chemist. Well, they'd not, because I phoned them. We then phoned the doctors, and they said the nurse had not even ordered them, and that Doreen had to phone them and tell them to order them. We then phoned the district nurse back and gave them that information, and they said they'd look into it and phone back later on in the day. Now, if they order them today, it's Thursday, then it's unlikely they're going to be there till Monday, on November the 8th. Doreen's feet were last changed at Leicester on the 30th of October. So it's going to be at least 7 days at the earliest before they're changed again. They should be changed every couple of days. Is it too much to believe that this kind of mix-ups are avoidable and they shouldn't be happening? As I said, the madness continues, much to Doreen's detriment. It is the 5th of November now. The saga of the missing dressings. Well, if you thought that could not get any worse, you're wrong. The district nurse phoned yesterday and asked me if the dressings had arrived. I told her no, and she said they'd been sent to the pharmacy. I assumed the pharmacy was a chemist, because they've got pharmacists. Well, not in this case. I phoned the doctors and they tell me that the prescription was sent down last night. I phoned the chemist back and he now says yes, he's got it, but as the prescription was not down till late last night, they hadn't been ordered yet. Bloody hell. Days and days go by and we now find out the bandages she requires and the special dressing ain't even been ordered. And he will not receive them until late on Monday the 8th of November. That means that I will not be able to collect them until Tuesday 9th of November. And then I've got to phone a district nurse and tell them, oh, the dressings have finally appeared. Remember, dressings should be changed every couple of days, but it will be at least 10 days before anyone will do that simple job. Doreen's feet are now worse than ever, all absolutely bloody unnecessary, and yet again we're left to chase our tails. It's not our job to chase doctors, it's not our job to chase nurses. That's why I've got a doctor. It's their job to organise this, and after 10 days they haven't even been ordered. The district nurse has just phoned and asked about the dressings. I told her I couldn't get them until Tuesday morning. She said she'd come out Tuesday dinner time. She phoned back within minutes and said it was far too long for Doreen to wait for dressings, and she and a colleague will come out straight away. Well, they arrived within 10 minutes. Joe and Sue. They were both efficient, capable, and treated Doreen with care and respect. Finally, Doreen has had her feet newly treated and bandaged. Two lovely ladies, and we are both very much in their debt for taking the initiative into their own hands and coming to treat Doreen. They certainly didn't have to do that, so thank you to both of them. 6th of November, Dora's been complaining again. Bandage is too tight on her feet and it's making the pain worse. The nurses are not due back until Tuesday the 9th, so she has decided to remove the outer sock unwind the bandages a bit and see if that helps ease off the pressure. Then we simply put the bandages and the socks back on again at a later time. 7th of November, well, having her feet with no dressings on and allowing the air to get them seems to have eased the pain. Maybe. 8th of November, the sores on her heels still continue to bleed, and it is probably down to the fact that her heels are resting on the pillow when she's in bed, but she's got a pillow propped up under her heels. She moves about a lot at night, although she says she don't. I'm telling you she does, which means her heels are rubbing on the pillow. Now the 9th of November, 10:30. Sue, the nurse, has just come and redone Doreen's feet. She had 2 washing up bowls with warm water in them and treating Doreen's feet one at a time. She removed as much dead skin as she could, but Doreen's terrified of the pain that she knows will follow, which didn't make Sue's job any easier. Sue showed me the new skin that was underneath the dead skin that she had been removing, and I could see an area about an inch square that was just pink new skin. Doreen is starting to heal, and Sue said it will take a couple of months. Sue plastered her feet with cream, bandaged them up. Dr. Page phoned and spoke to Doreen at some length. She's issuing another prescription for tablets and a 3rd bottle of Oromorph. 16th of the 11th. Today is the day that Joe the nurse is coming to dress Doreen's feet, and as usual there is a problem. Doreen's Oromorph ran out yesterday, which means she'll have no pain relief to help her cope with the additional pain with Joe removing dead skin. If it's not one thing, it's another. It's hard, it can't be that hard to ensure a continuous supply of Oromorph. And remember, her original pain, still undiagnosed and untreated, is still there. 22nd of November. Over the past few weeks, the nurses have been coming twice a week, well, when they can, when they've got the dressings, to look at Doreen's feet and redress them. I take a peek at Doreen's feet when I can, trying not to get in the nurse's way, and quite truthfully, I see little improvement to them at all. The weeks go on, and I look at them and I think, I would hope they'd be more improved than they are, but they're not. Her pain level is extremely high, and the Oromorph does help for a short period of time, but the 2 problems exist. One is her undiagnosed condition, and the second is her now badly damaged feet. Doreen is going to Queen Elizabeth Hospital in Welwyn Garden City this morning, 8:30, to have her arm looked at by a neurologist. Her left arm has not been working since 25th of October, so 4 weeks, a month. It's bad enough to have 2 major problems, but when you can only use one arm to do anything, it becomes nigh on impossible, and it doesn't take much to get Doreen wound up with pain and frustration. I've got an appointment coming up soon, 2nd of December, to go to the new Royal Papworth Hospital in Cambridge. Not looking forward to that or the possible results. I'll leave this video at this point and start part 6 when I know how she's got on at the hospital and what the diagnosis is with her arm.